Welcome. Today we're exploring a medical condition that often flies under the radar, yet can have a significant impact on health: tuberculous peritonitis. Tuberculous peritonitis is a rare but serious infection that affects the lining of your abdomen. Many people have never heard of it, but understanding it can make a real difference in early detection and treatment. The peritoneum is a thin, delicate membrane that lines the inside of your abdominal cavity and wraps around organs like your stomach, liver, and intestines. It acts as a protective barrier and helps support your internal organs. When this lining becomes infected by Mycobacterium tuberculosis, the same bacteria responsible for causing tuberculosis in the lungs, it leads to a condition called tuberculous peritonitis. This infection can cause inflammation, swelling, and discomfort in the abdomen. While most people associate tuberculosis, or TB, with lung disease, the bacteria are actually capable of traveling through your bloodstream or lymphatic system. This means TB can reach other organs, including the abdominal cavity, and cause what's known as extrapulmonary TB. Extrapulmonary TB refers to any tuberculosis infection that occurs outside the lungs. Tuberculous peritonitis is just one example, but it's a particularly challenging one because it can be difficult to recognize. In this condition, the peritoneum becomes inflamed and infected, leading to a range of symptoms that can be confusing and easily mistaken for other illnesses. Because tuberculous peritonitis is so rare, it's often misdiagnosed. Its symptoms, such as abdominal pain, swelling, fever, and weight loss, can mimic many other abdominal problems, including infections, cancers, or digestive disorders. Doctors may not immediately suspect TB as the cause, especially if a patient doesn't have a history of lung tuberculosis. That's why raising awareness about this condition is so important. The symptoms can be vague and nonspecific, sometimes resembling irritable bowel syndrome, appendicitis, or even certain types of cancer. This makes diagnosis a real challenge. It's crucial to remember that tuberculosis isn't just a lung disease. It can show up in unexpected places. So keeping an open mind is key for both patients and healthcare providers. In this video, we'll walk you through how tuberculous peritonitis develops, the warning signs to look out for, how doctors diagnose it, and what treatment options are available. We'll also discuss who is most at risk and why early intervention matters. By understanding this condition, you'll be better equipped to advocate for your own health, support loved ones, and recognize when to seek medical advice. Early awareness and timely diagnosis are the keys to a successful recovery. Let's get started and learn more about tuberculous peritonitis together. Tuberculous peritonitis is a rare but serious form of tuberculosis that affects the lining of the abdomen. It all begins with infection by Mycobacterium tuberculosis, the same germ responsible for all forms of TB, including the more common lung infection. Most people contract TB by inhaling tiny droplets released when someone with active lung TB coughs, sneezes, or even speaks. These droplets can linger in the air, especially in crowded or poorly ventilated spaces, making transmission more likely. However, not everyone exposed to TB bacteria will develop symptoms. Many people have what's called latent TB, where the bacteria remain dormant in the body, kept under control by a healthy immune system. These individuals aren't contagious and may never become ill. But if the immune system becomes weakened due to age, illness, or certain medications, the bacteria can reactivate and spread beyond the lungs to other parts of the body, including the abdomen. The most common way TB reaches the abdominal lining is through the bloodstream. This can happen during an initial infection or if latent TB becomes active again, allowing the bacteria to travel from the lungs to distant organs. Alternatively, the bacteria can move through the lymphatic system, which acts as a highway for immune cells and can carry TB germs to the abdomen. In rare cases, TB can spread directly from nearby organs, such as the intestines or fallopian tubes, especially if those areas are already infected. People with weakened immune systems, such as those living with HIV, undergoing chemotherapy, or taking immunosuppressive drugs for autoimmune diseases, are at much higher risk of developing tuberculous peritonitis. It's important to know that you cannot catch tuberculous peritonitis directly from another person. Only the initial lung TB is contagious. The spread to the abdomen is an internal process that happens within the body. This internal spread means that abdominal TB is not a public health risk in the same way as lung TB, and it cannot be passed from person to person through casual contact. Understanding how tuberculous peritonitis develops helps reduce unnecessary stigma and fear, allowing patients and families to focus on recovery and support. The key to prevention is early identification and treatment of TB, especially in high-risk groups, to stop the bacteria from spreading beyond the lungs. Raising awareness about TB, its risks, and its prevention is the first and most crucial step in protecting yourself and your community from complications like tuberculous peritonitis. Tuberculous peritonitis often starts with subtle symptoms. You might feel unusually tired, have a low-grade fever, or experience night sweats. Appetite loss and gradual unintentional weight loss are common warning signs. Abdominal discomfort is typical, usually a dull ache or persistent bloating, not sharp pain. This discomfort is often due to fluid buildup in the abdomen called ascites. The bloating may worsen with movement or pressure. Changes in bowel habits, constipation, or diarrhea can also occur, but there's no set pattern. These symptoms can easily be mistaken for less serious issues. The key is persistence. If fatigue, fever, night sweats, appetite loss, weight loss, and bloating last for weeks, see a doctor. Don't ignore ongoing changes in your health. Early recognition can make a big difference. Listen to your body's signals. Persistent symptoms deserve attention. As the condition progresses, symptoms become more obvious. The most dramatic sign is visible abdominal swelling from fluid buildup, ascites. The belly may look distended and feel tight or firm. Pain can become more constant, and pressing on the abdomen may reveal a doughy or lumpy sensation. This is a classic clue for doctors. In severe cases, inflammation can block the intestines, causing severe pain, vomiting, and inability to pass gas, a medical emergency. Other signs may include a persistent cough or swollen lymph nodes indicating TB is active elsewhere. When abdominal swelling is paired with symptoms like night sweats or cough, doctors are more likely to suspect TB. Recognizing these patterns is crucial for timely diagnosis. Don't hesitate to seek help if you notice these changes. Let's take a closer look at Maria's story, a journey that many people might find familiar, yet often goes unspoken. Maria, a 34-year-old teacher, began to feel unusually tired. At first she brushed it off as the result of a busy work schedule and the everyday stresses of life. But as weeks turned into months, her fatigue only deepened, and she started to lose her appetite. She noticed her clothes getting looser, and the numbers on the scale dropping, but she blamed it on stress and skipped meals, never suspecting something more serious. Soon, persistent bloating set in. Maria wondered if she had developed a food intolerance, so she started reading labels and cutting out foods she thought might be the culprit. But no matter what she tried, the swelling only worsened. Her belly became visibly distended, making her self-conscious and frustrated. She felt like her body was betraying her, and the discomfort began to affect her daily life. Growing more concerned, Maria finally decided to visit her doctor. The doctor listened carefully and ordered blood tests, along with an abdominal ultrasound, to get to the root of her symptoms. The ultrasound revealed a significant amount of fluid in her abdomen, a finding that was both alarming and confusing. The cause, however, remained unclear, leaving Maria anxious for answers. She was referred to a specialist who asked detailed questions about her health. During their conversation, Maria mentioned experiencing mild night sweats, a symptom she hadn't thought much of before. This small detail, combined with her other symptoms, raised the possibility of a rare but serious condition, tuberculous peritonitis. To confirm the diagnosis, a sample of the abdominal fluid was drawn and sent to the lab for analysis. The results finally provided clarity. TB bacteria were found in the fluid, confirming the diagnosis and ending months of uncertainty for Maria. Maria's journey is a powerful reminder of how easily symptoms can be missed, misattributed, or dismissed as minor issues. Her case highlights the importance of considering tuberculosis, even in places where it's less common, when faced with unexplained abdominal illness. Early and thorough investigation can make all the difference, leading to timely treatment and better outcomes. If you or someone you know has persistent, unexplained symptoms, don't ignore them. Seek medical advice and advocate for your health. Diagnosing tuberculous peritonitis requires detective work. It starts with a detailed history and physical exam, focusing on symptoms and risk factors. Imaging tests like abdominal ultrasound or CT scan help detect fluid and inflammation. A chest X-ray may reveal signs of TB in the lungs, strengthening the suspicion. The key step is sampling abdominal fluid through a procedure called paracentesis. The fluid is analyzed for TB bacteria using special stains, cultures, or rapid genetic tests. Sometimes a laparoscopy is needed to directly view the peritoneum and take a tissue biopsy. Biopsy is the gold standard for confirming the diagnosis. These steps help distinguish TB from other causes of abdominal swelling. Early, accurate diagnosis is essential for effective treatment. If you have persistent symptoms, ask your doctor about these tests. Don't settle for vague answers. A thorough workup can save lives. The good news, tuberculous peritonitis is treatable. Treatment involves a combination of 4 antibiotics for 2 months, followed by 2 antibiotics for at least 4 more months. The total course usually lasts 6 to 9 months. It's crucial to take every dose as prescribed to prevent drug resistance. Doctors monitor for side effects and may adjust medications if needed. In some cases, fluid may be drained to relieve discomfort. Surgery is rarely needed unless there are serious complications. Most patients recover fully with proper treatment. Recovery begins soon after starting antibiotics. Fever and night sweats often improve first, followed by appetite and energy. Abdominal swelling gradually subsides as fluid is reabsorbed. It's vital to complete the full course of treatment, even if you feel better. Stopping early risks relapse and drug resistance. Most people make a full recovery and return to normal life. Rarely, scar tissue may form, causing future complications like bowel obstruction or infertility. Regular follow-up ensures any issues are caught early. Focus on good nutrition and rest during recovery. With proper care, long-term problems are uncommon. Awareness of tuberculous peritonitis saves lives. Recognizing that TB can affect more than the lungs leads to faster diagnosis and treatment. Early treatment means better outcomes and fewer complications. Reducing stigma around TB encourages people to seek help sooner. Anyone can get TB. It's not a disease of the past or limited to certain groups. Share what you've learned to help others recognize symptoms. Informed communities are healthier and more compassionate. Knowledge is your best defense. Use it to protect yourself and those around you.